Hi everyone, I'm Dr. Jayendra Yadav, consultant neurologist. I practice at New Panvel, Advita Neurology Clinic. My clinic is situated just opposite to DMart in New Panvel. So today I'm going to discuss about very important neurological disease, dementia. So all of you must have heard that this word dementia. What dementia exactly means? So our brain performs various functions. Memory is one of the important function of the brain. But other than that, our brain is also responsible for many other neurological functions. I'll say executive function. What does executive function mean? Executive function means planning, prioritizing our work, then other neurological attention maintenance, performing complex tasks, multitasking. All these functions comes under executive function. Then social awareness, something focusing on something and trying to distract ourselves from other activities. Performing motor activities, just not performing motor activities, performing those activities in coordination and doing those activities in a proper way so that our goal activity for which the directed is performed in a proper way. Then our coordination, our balance, our speech, language, what words to use, how to convey what we want to say in the list words, and maintaining complete sentence, speaking in complete sentences. This is a language function. What other person is trying to say, and then understand what, and then respond appropriately. All this is are functions of the brain. Vision is also an important function. Then recognizing people, recognizing sounds, objects. All these are all the functions of the brain. So all these functions are called. These are various cognitive domains of the brain. So affection of any of these cognitive functions, and if they are progressive one and they are affecting person's day-to-day life, then we will say a person is suffering from dementia. It's not just if a patient is have a memory issue, but all affection of all these cognitive functions some way or other impairs person's memory ability, and that's why the commonest symptom which patient with dementia will complain is memory dysfunction. So dementia is more common in older age group. They not that young ones don't suffer from dementia, but there are different causes. The dementia which occurs in older age usually due to neurodegenerative disorders like Alzheimer's disease or frontotemporal dementia. Although these neurodegenerative disease, science has not as of now found any cure, but it is imperative that we diagnose these neurodegenerative disease at the earliest, so that at least some symptom relief we can offer them, and then family also can be counseled, and we can plan future treatment modalities for these patients. And along with that, what is more important is to rule out whether there is any treatable cause for this cognitive decline. There are many reasons for some person suffering for this cognitive deficit. The commonest, I would say, just a depression. If a person is depressed, he is not attentive, so he will not register things very well. He will not be able to do complex multitasking. Cognitive function will be impaired. Language function also can be impaired to some extent if the person is severely depressed. Certain nutritional deficiencies like vitamin B12 deficiency. Suppose somebody is anemic, low hemoglobin itself affects brain function. So if somebody is having any cognitive dysfunction at younger age or at older age, it's very important to consult neurologist at the first. Getting consultant first, and if we need to try and find out whether there is any treatable disorders. Sometimes just diseases like improperly controlled hypertension, diabetes, those also contribute to the potential cause cognitive decline. So proper treatment of the risk factors is also important in treatment and the diagnosis of the dementia. Thank you.